Hey everybody, hope that you're doing well today. This is Stephen with Junior Achievement, here with our JA Career Speaker Series. I'm super excited today. We have Aimee Kaltenbach from Atlanta, Georgia, just sharing a little bit more about her job story, how it's changed, all that good stuff. So Aimee, thanks so much for joining us today.
Yeah, thanks for having me.
Awesome. So go ahead. Very first part is introduce yourself, name, job, where you're from, all that good stuff, whatever you want to share with us.
Cool. So my name is Aimee, and my job is technically the job position is a doctor of audiology, which
Oh,
is
wow. Okay.
not something a lot of people know about. I didn't know about it until I went off to school for it. So basically, that means that we're clinicians in a healthcare setting that specifically care for all types of hearing and balance
Mm,
disorders.
okay.
Um, and that looks like a lot of stuff. We can talk about it a little bit if you want to. But I'm from a small town in the heart of Georgia. Been told it's not South Georgia, it's not North Georgia, it's not Atlanta, Dublin, Georgia. So
Dublin. Okay.
Irish, Dublin. And I've been married for 3 years.
Okay.
I just got a
Congratulations.
puppy because that's how
Wow.
I'm handling the pandemic,
That's
um,
awesome.
is through pet therapy. Um, and she's insane. So that's just about all.
That's awesome. What type of dog?
She is a mutt,
Mm.
which we got her from an organization called Mostly Mutts. So
Okay.
that that's kind of it.
It's a good
But she's
fit.
she's primarily a shepherd mix, but
Okay,
there's some
cool.
cow dog and some hound, and she's got a pretty intense like howling thing she does. So the hound comes out.
That's awesome. Well, I'm glad that you have a dog. And once again, thank you so much for sharing your story today. So very first question, perspective of being in high school, is what was your thought process in high school in the sense of what did you want to do? Like, did you go straight into work? Did you go to college? Like, what was your major if you did go to college?
Yeah, so I was a pretty good student in high school, and I looking back, it's pretty funny to me how little I actually people talk to me about job readiness. Like it wasn't anybody else's fault, but I just think maturity wise, I didn't I just really didn't have any understanding of what it looked like to be in a professional job. And
Mhm.
so I did go straight to college, and I
Okay.
went to Georgia, and I had a great
Mhm.
experience. My most of my work capacity through school was in university housing. I worked for them for 4 years,
Cool.
and that was really great because I love being around people. I learned a lot of
Mm.
leadership skills. I learned a
Yeah.
lot of way too many conflict resolution skills, more
Yeah,
than
I
I
bet.
wanted. Called the police entirely too many
Oh, wow.
times, but um, it helped provide financial assistance through
Mm.
school, which
Yeah.
was really helpful. But also, I had to learn that balance of work and school to an extent early on. And then in high school or in college, I really didn't honestly, I didn't think about my major very much. I don't think
Mm.
I really had found something I aligned with. And so I didn't really care. I just kind of did my classes and tried to do well, and
Yeah.
keep finding my niche. But everything I kept coming back to is that I just liked being around people.
Mm.
But I wasn't in business. I was kind of heading in like a health sciences direction, had
Okay.
thought about speech language pathology. And so I got into a major for speech language pathology. And then in the process of preparing to apply for grad school, found out I didn't like it, which
Oh,
was a little late. I was like a
okay.
junior when I figured that out. Um, and that wasn't great because all my
Yes.
friends were getting ready to go on to their grad
Leave.
school jobs
That
or
makes sense.
internships, and I was just not. So I, around the same time, bumped into audiology, which is a much, much smaller field,
Hmm.
through meeting some deaf folks, big D deaf. So people that communicate via American Sign Language and don't have hearing aids, don't have cochlear implants, choose to be
Got it.
deaf, and was really fascinated by that.
Hmm.
And kind of just said, I'll go to school for audiology, which is not how I recommend people graduate programs that take 4 years, but it was a really good fit,
So did
luckily.
you end up graduating on time since because you said you were in
Mhm.
speech language
Yeah,
pathology, correct? Until
yeah.
junior year.
Yes.
Okay,
So
but then you
the way that
switched.
it works at Georgia is you have to do like a 2-year cohort, and it's junior and senior year.
Got it.
So luckily there's like no prereqs for audiology.
Okay,
That worked out.
wonderful.
So, and they're kind of cousin fields, speech
Yeah,
and audiology. So, um, like 40 people go off to do speech, and then like 2 go off to do audiology. That's kind
got
of
it.
how we
Okay,
trip.
well, awesome. So it sounds like college was really necessary for you in the sense of just preparing for like the workforce, even though like you were really capable and even in high school where you could have gotten a job, it sounds like those 4 years or
Mhm.
even beyond that was like beneficial where you're like able to hone in like to a really specific field that you
Mhm.
obviously had no idea that you would have been passionate about in high school.
For sure, for sure. I definitely wouldn't have found the field. I also feel like, and I don't think it has to happen in college, but in my particular instance, I think a lot of maturity happened in college.
Yeah,
That, and I had a similar experience in grad school. I think a lot of my experience in grad school, I mean, I was doused in content in clinical
yeah,
settings, but a lot of what I learned was how to be a professional in the workforce, how to take
yeah,
responsibility for my actions,
for sure.
how to take initiative when I have a problem. Like I feel like some of those critical thinking skills kind of intersected with those settings. I think I could have learned them elsewhere, but
Yeah, for
um,
sure.
for me, I learned them in higher education settings.
Cool. That's awesome. So once you graduated college, it sounds like you went straight to graduate school. Is that correct?
Yep. Yep.
Okay. Cool. Okay. Awesome. So then where did you go to school?
I went to East Tennessee State University.
Okay.
Go Buccaneers. Yeah, it's a maybe 15,000 people in a really small town.
Oh, okay. Neat.
Way East Tennessee, Johnson City, beautiful country.
Yeah.
I picked it because I love the mountains, and they said, "We'll
Hmm.
give you some money," and I said, "Great
Perfect fit.
combination.
Yeah.
How could I turn it down?" And I spent 3 years there, and then a year of residency afterward at the University of Kentucky in Lexington.
Got it. Okay. Cool. So then that ultimately led you to back to Georgia, sounds like, correct?
Mm-hmm.
Okay. And
Mm-hmm.
that's where
Yep.
you're currently living.
That's where I'm currently living.
Okay. Got it.
Yep.
That's
I
awesome.
swore I would never move back to Georgia for no good reason, and
Hey,
I love it, and I'm so happy to be back. So
that's
don't
awesome.
listen to yourself.
That's
Never
really true.
say
I feel like that's always necessary. Do not listen to your own self and never say never. Justin Bieber.
it.
The question is, now that you're working in like professional workspace, can you kind of go in a little bit more in depth into your job? And also, before COVID-19, before social distancing, what did it look like?
Yeah, so I work for a large hospital system, actually more of an outpatient setting. So the system's called WellStar. We mostly serve west and northwest suburbs. So,
Hmm.
gosh, I don't know how many million people probably live in those suburbs, but it's a, a fair amount of people. And we've got, my specific group has 6 or 7 offices. So
Wow.
I work on a team of people that work under ear, nose, and throat. So audiologists can
Okay.
work in lots of different types of positions, but it's pretty common to work in conjunction with ear, nose, and throat. So a normal week for me would look like a combination of supporting ear, nose, and throat patients with testing. So when they come in, doing
Okay.
hearing tests, doing tests to look for fluid in the ear, more extensive tests of balance for people with particular types of conditions. And so I'm doing some of that in conjunction with them. And then I see some patients independently,
Got it.
like kiddos that are having speech problems, or kiddos that fail their hearing screenings when they're born, kiddos that have hearing loss, and then also adults or older adults who have hearing loss and hearing aids.
Yeah.
So kind of it's days are all over the place as to what my schedule would look like, but Monday to Friday, 8 to 5, seeing patients basically.
Hmm. Okay. So assuming obviously you are an essential worker, has your job really changed at all with social distancing and like with
Yeah.
COVID-19?
Yeah. So we're, like I said a couple times, we're teeny tiny field,
Okay.
and we've done a lot of things backwards legislatively, and we don't have a lot of money power, aka manpower. So something that was really difficult, we already had a lot of issues with reimbursement. When we do something in the clinic, a lot of things that we do don't get paid, but we do them either as a value added service, or we do them in conjunction with something we can bill for. But compared to like a physician or even a physical therapist, like if I counsel a patient for 30 minutes, I can't get paid for it.
Interesting.
So on whatever, so the interesting thing is all these sweeping bills came out to suddenly pass telehealth through, and none of them apply to us. So as far as insurance coverage, now we were told you could arrange a self-pay situation with patients, but in a large health system, that stuff takes a really long time. Then you got law anyway.
Yeah.
So for us, it's been a little paralyzing, to be honest, and it's really exposed to me the fact that we as a field we knew we were behind on some things, but like people's needs haven't changed.
Right.
We've continued to have people calling and needing things and having questions, but we're paralyzed to helping them the way we'd like to because of our inability to get paid. Which again, that may sound greedy or selfish, but if people can't get paid, like industries don't exist, services don't exist. So trying to navigate how to still provide evidence-based good care to people while keeping them safe has been very complicated. It as time goes on, we've all gotten a little more comfortable with, hey, this isn't 2 weeks. We have to figure it out. Like we can't like, don't come in right now. It's like, just take a breath. And like, when do we triage and say, you get to come in under these circumstances and we're going to do things this way? And when do we say, hey, like, I'll meet you like I've done a lot of curbside hearing aid checks where you pull up in your car, and just like McDonald's, I come outside in borderline hazmat suit, and I take your stuff and then I do it, and then I bring it back. And I've had patients be like, this is great, we should keep this up. And I'm like, okay, maybe, probably not, but that's fine.
Wow.
So
your job has definitely changed.
Oh yeah.
Now, do you still go to the office, I assume?
I'm going to the office several days a week. Our office has had to have people take a day of vacation every week, just because elective surgeries have been canceled, and a lot of our group's revenue is coming from ear, nose, and throat physicians doing surgery. They're not doing much surgery. So that's like a giant pot of money that's gone away. And that's probably true for most types of medical, clinic kind of offices. So, I just appreciate that they're being transparent with us and they're trying to keep us employed, because they certainly don't have to. And so I guess I'm trying to see it from a business perspective as well as a healthcare perspective.
Wow. Yeah, absolutely. I mean, it's really interesting to hear how your job is, on the sense, like not being recognized as a whole, where people are like, they're not wanting to provide these funds for like totally inclusive for all of your patients. That's honestly kind of sad. But I mean, in the midst of like all this change, like, is there something that you've like deemed as positive that you're like, man, this is a really cool thing that I've experienced personally, that honestly you do hope that continues, whether it be job, whether it be personal?
Yeah, I think we've gathered some things at the office. I think we haven't really had a true debrief, and I hope that from a leadership perspective we can do that at the office by the time this is over, whatever that over means. I think that would be valuable. Personally, this just intersects with a lot of things I was already sort of exploring, about just disconnecting from technology more, which is funny because we're still way more connected to technology in a lot of ways, but sort of the idea of just living a little bit slower and asking the question, like, why is my schedule so full? What about all of this is really life-giving to me, and what about this is just thinking I need to go sprint back into the world every 5 minutes. So
Yeah.
I was already reading a book called The Ruthless Elimination of Hurry, hilariously, before this came down. Great book.
Okay.
But the two are, he's talking about the history of hurry and how in the 1960s, some futurists thought that Americans by 1985 would only work 22 hours a week and 27 weeks a year because of how they saw technology changing our world.
Yeah.
And in fact, Americans now work 4 weeks more a year than they did in 1985. So just kind of asking myself just some questions about how to live in a way that not to eliminate work, but to eliminate hurry, you know?
Yeah.
So
That's really fascinating. I'm curious how the job world will really transition and evolve. I guess when we go back to normal, I don't know what that normal will look like, but if businesses will have a stay home or like work from home day, because just even I've talked to another professional and they're thinking maybe businesses aren't going to want to rent out these massive office buildings anymore just because they've seen how productive they've had to be like working from home. And so I think it's really exposed us in the sense of like, what is essential? What can we do? Like, how can we be just as productive, honestly, maybe even more productive in a time where we have to use technology more than ever before. That's really cool. It sounds like, wait, sorry, continue.
No, I was just saying, and asking the question of like, what is productive? Is productive all about our companies doing better? Or is it, hey, you know, there's this many less mental health problems. People are spending this much more time with their family and our business revenue is the same, you know, like quantifying it in a more holistic way and understanding that you're going to keep employees around. There's just a lot of benefits. So
yeah, it's really true just to like take a step back and really evaluate what's going on. Unless it's just necessary. And can you say the name of the book and also the author?
Yeah. The book is called The Ruthless Elimination of Hurry by John Mark Comer.
Let's go ahead, kind of wrapping things up. We are in a world of chaos and trying to figure everything out. Why is it important to have stability in one avenue of our life, like finances? Can you explain what you've learned even specifically in this, or also how you prepared?
Sure. So I said we've been married for 3 years. The first 2 years of our marriage was, a lot of it was us working on paying off debt. And so we finished that exactly a year ago. Actually, it was April last year, paying off about $43,000.
Wow.
And, there was we learned a lot of stuff, a lot of great stuff about marriage, about self-discipline through that.
Yeah.
And then, after that, kind of trying to look forward to the future and really keep an emergency fund that's going to protect us from reasonable emergencies. And it's just, I guess funny is the wrong word, but my husband literally chopped his ankle with a hatchet 2 days ago, and we had to go to the ER, and then we had to, have an x-ray and go to the orthopedic doctor. And we've had another, it's him, he's always the problem, but he fell down the stairs and broke his toe in half a couple months after we moved to Georgia, and that was a several $1,000s situation as well.
Yeah.
So almost every time we've had a giant emergency, we looked at each other and said, this would be so different if we didn't have a little bit of money set aside for this stuff. So just in the midst of a time where we already have been like, we think we're going to have our jobs. We're very blessed in that regard, but we might be furloughed for, there could be some changes, but like other emergencies still happen. So having that stability, not putting our hope in money, not putting our, not getting excited about, oh gosh, our money is going to take care of us, but saying, if we've got this available to us, we better steward it wisely, because otherwise it's our own fault. you know?
Yeah, I mean, it goes to show that medical emergencies happen no matter what the time. It's not like they care about if
They
this
don't
is a good
care.
time or a bad
They
time.
don't
Like,
care. They don't even ask.
it just comes out of the blue. I mean, we just had car issues, and that was like
Yeah.
$600 out of the blue. We're like, oh, okay. It
Oh,
was nice to
there it is.
have like an emergency savings. It's really like um, beneficial to really go. You did mention like student debt. Is there anything like
Mhm.
advice that you would provide to students as they are thinking about entering into the educational world and trying to figure out all this, like what is student loans, like how, like is there anything that you would recommend or advise from past
Yeah.
mistakes or things that you've learned?
Yeah, so the best advice I ever got, and again, this sounds probably super weird, but best advice I got from college going into grad school, sat down with my advisor, who is an audiologist, and I was like, all these schools, this one's better than this one.
Mm,
The rankings, this is number 10, this is number 30. And she was like, follow the money, follow the money. And I was like, but what if I get, and she was like, money, follow money. She was like, come out, you're going to make the same no matter where you go to school.
yeah,
You're going to come out, and I've totally learned this. You are going to make of your education what you want. And especially with the access we have, if you want to be in a medical profession, and you want to go find some extra clinicals, you can.
mm,
You can supplement in whatever ways you want. So I have experienced a lot of people telling me like, oh, you just can't find money for this, this, and this. And I got, just on top of the scholarships I was given in grad school, I probably found about $20,000 of excess tuition funds.
wow,
So my first year was covered through a tuition scholarship I got when I was accepted. My second year, I found a research job. I did that. And then my third and fourth year scholarship alone from like a hearing aid company. So,
wow,
and that wasn't something my school brought to me. That's not, it's just, I found a leadership scholarship, applied for that, and I was very blessed to be granted those scholarships, but
yeah,
I spent a lot of time writing scholarship essays.
yeah,
Got a lot of money out of it. So I guess what I'm working with a couple of high school students who are doing some shadowing, and my encouragement to them is don't let somebody else tell you that it's not out there, because they
mm,
would love to. They would love to tell you that there's no money for you. College is too expensive. You have to take out loans. And I think that if loans are the only way that you can support an affordable education, then for some people that has to happen. But
yeah,
don't make that step one. Look for every scrappy piece of money you can get. And I
that's good.
promise your future employer is going to be really impressed that you figured it out.
That's awesome. That's really honestly great advice. I mean, pretty much, did you just Google like
Yeah, you
scholarships?
Google
Okay.
it. I mean, the internet is like, there's so many things. And you don't have to find things related to your field, but I
Mm,
promise there's probably some stuff related to your field. You can also just be like, if anyone just research it all, you can always show up at people's door and be like, did you need an assistant? Oh, you didn't. Did your friend need an assistant?
yeah,
They didn't. Oh, what about this program you guys run? Do you have a grant?
right.
Ask. Don't let people come to you. Say, we really wanted to give you this full ride scholarship. Create opportunities where you would add value and see if someone will pay you.
Hmm. That's
So
awesome. That's really
be
wonderful advice.
scrappy, get the money. That's
Be
my advice,
scrappy and get the money. I love that. That's a good motto.
you know?
That's awesome. Well, Aimee, thank you so much. I
Yeah.
really appreciate your time, your insight, wisdom, just even sharing to these students what your job specifically does and honestly how it's changed, some good, some bad, with COVID-19. So appreciate you, and we'll see you.